An appointment with a specialist or doctor today at mountelizabeth.com.sg.
Wake up in the morning. It's the way Singapore wakes up. Wake up, Glenn, Angel, and the Flying Dutchman. Wake up in the morning feeling like Kiss 92's Big Show.
Except this morning you have Angel, Daphne, and the Flying Dutchman as Glenn is on leave. And we also have in the studio, because it is Good Morning Doctor, Dr. Adrian Chan. Good morning, Dr. Chan.
Good morning, everyone. Good
now,
morning.
let me just introduce you. You are a respiratory physician and intensivist at Mount Elizabeth Novena Hospital. Now, we know what a respiratory physician is. What is an intensivist?
All right. So I actually do see patients who are more sick, and when they require a higher level of care that the general ward cannot support. So that's where they land in either the high dependency or intensive care unit, and that's where I try to come in and support and help the patients.
That's why
got it.
intensivist.
Right.
Is it
okay.
only to do with respiratory issues, or you also work with other things as well?
I work with a variety of other specialists. So I do some of the patients obviously come in with respiratory problems that require life support, what we call a ventilator. But on top of that, sometimes they may have other issues as well, surgical issues, heart issues, brain issues. So we help the various specialists to support their organ function and hopefully get the patient better to go back to the general ward and hopefully towards the road of recovery.
Okay.
So today we're going to talk a little bit about COVID-19 and the wonderful situation that it's put this planet in.
Wow.
A lot of people believe, I've got COVID, I'm done, I'm not going to get it again. So where do we stand on that? Because some people have had it 3 times.
I've had it twice.
Wow.
Yeah.
Okay. Yeah. So unfortunately, the clear answer is that if you had COVID infection previously, it doesn't grant you a lifetime of immunity. So we get our immunity from COVID acquired from previous COVID infection or perhaps when we get vaccinated, per se. But even if you have either of these or both before, which is unfortunate, it still doesn't give you full immunity forever. And the COVID virus is essentially a very smart virus. I think all of us have recognized that in the past few years, we have seen it evolve. Various variants have come on as well. So the data does suggest that if you have had previous COVID infection from one of the earlier variants, unfortunately, the newer variants will be able to evade the immune response that was generated by these previous infections. In fact, there was a local study that was published recently that showed that if you have the variants, and I'll list out the variants here, so alpha, beta, and Delta virus.
I had the Delta. I had the Delta.
Yep. And that was horrible.
That was horrible,
That was
yeah.
horrible. Yeah. So unfortunately, it grants little or no protection against the Omicron variants.
Which I had later on as
Oh,
well.
dear.
So I had both the Delta and the Omicron.
Yes.
Okay, let's talk a little bit
Yeah.
more. Let's go more into detail about the different variants on the Big Show TV. If you want to join us, head to our YouTube and Facebook channels. That's that's COVID brain right there. That's / Kiss 92 FM. Right now, here's Beyonce on Kiss 92.
I feel like falling in love.
Okay, so we're with Dr. Adrian Chan, who's a respiratory physician and intensivist at Mount Elizabeth Novena Hospital, and we're talking about COVID. Can you run through the different variants again?
Right. So we have these older ones, such as the alpha, beta, and delta variants.
Does that indicate the timeline almost?
It's sort of. We
all right.
started off with alpha, beta, and you know how you follow
kind of
the Greek
alphabetical order,
Yes,
right?
yeah, right.
Yeah.
Yeah, the Greek alphabets. per
There was
se.
no C, obviously. No
that
Charlie.
was it. Yeah. Yeah. Then some genius decided to name it the Omicron
Yeah.
variant,
Right.
and that's been the predominant variant for the past 1 to 2 years.
Yeah.
Per se, and even within the Omicron, there are the sub variants.
Yeah.
So you have BA1, BA2, and then BA4, BA5, and the very cutely named XBB.
Yeah.
Right?
Yes.
And right now, we are dealing with another new variant, another new subvariant,
That's
which is
right.
called the Iris.
Yes, that's the newest one,
So
yeah.
these are, in fact, in America, the data is out that this is now the predominant strain. In Singapore, I think this is probably going to become even more prevalent.
Right.
See? So I think we have to see how this current variant pans out.
Okay, so with all these variants, here's the thing. So it evolves as we go along, right? But that's not to say that Delta, Alpha are no longer there. They're still there, correct?
Yes.
So if I got Delta, and this is where we are now, right, with the current subvariants of Omicron, can I get Delta again? That's the question.
Has it already changed into something else? Is that what you're saying?
No.
Is it still
I
around?
got Delta.
Yeah.
Am I immune to Delta? Am I only going to catch the newer
Something else.
variants? Or can I catch an earlier variant now?
Yes. So the good news is that first up, I think we have to see what's prevalent in the community. So if you had caught Delta, the data suggests that you will probably have very good immunity
Against
the
Delta.
Delta
Right,
variant.
okay.
So even if it's around, which is thankfully no longer the prevalent strain or subvariant, then I think your immunity is good.
Okay.
But unfortunately, towards Omicron, that's where, the virus is, when it becomes a new variant, it's actually structurally slightly different. So the immunity takes time to catch up. So it doesn't recognize the new variant so well. And even if, let's say, you had the earlier subvariant, so that means you have had BA1 and 2. Right. What happens is that your acquired immunity against the newer subvariants, so that's BA4, BA5, XBB, and right now we don't really know about Aries yet. The acquired immunity is also shorter. You still have immunity,
Right.
but the strong protection is actually shorter and it wanes more quickly.
Wow,
Yeah.
okay. What about for those people, and there are still people that exist who are COVID virgins? They have not caught COVID. I think
Yeah.
Shalini, if I'm not wrong, has not had COVID yet,
Okay.
and who is our producer. She's currently on leave, but she's the only one amongst all of us, and we're a big team that has not had COVID. Does that mean, is that likely that they will never get COVID in their life, or that they've got a stronger immunity? Because sometimes people who didn't get COVID, they're like, oh, your immunity is so strong, you didn't get sick and stuff like that. What does it actually mean?
Well, very lucky if she or he hasn't had COVID before, but that doesn't mean that your immune system is necessarily strong or immune against COVID-19. All right. Now, to be fair, all of us within this room, our immunity system varies from one individual to another,
Yeah.
and I think that's partly because of our genetic makeup.
Yeah,
Right.
of course.
Now, the other thing is that even within the individual, our immune system varies from time to time. So, for example, if your body is under stress, the immune system is lower, maybe there's a concurrent illness, then perhaps, you are still somewhat prone to COVID. And we have already recognized there are some individuals who are more susceptible. They have risk factors. So I think we have been keeping an eye out for these individuals. So if they have risk factors, I'll state some examples. If they are perhaps cancer patients, they have certain, serious cancers. They are on certain medicines that somehow are associated with a lower immune system. The immune system is suppressed. They may be organ transplant patients. Now, this group, we have to look out for them, because essentially they are more prone to get COVID-19 infection. So I think it's an interplay of many factors, partly genetic, partly acquired factors. So, but the overall conclusion is that no, unfortunately, if you've never had COVID, it doesn't make you, invincible per se.
But it could also be that that you have had COVID, but you were asymptomatic.
It is possible.
You could have gone through your days and all that having had COVID, right?
Yeah, so there was also a scene, in the past 1-2 years where some of our individuals actually, because we would at one point in time we were testing so heavily, right? So and it was mandated by workplaces, by employers per se, and we found out that actually there are some individuals who had positive COVID, but they were totally asymptomatic.
Yeah.
Good for them. I would love to have if let's say I had COVID, I would love to have zero symptoms.
Yeah.
All right, but I think the majority would still encounter some symptoms.
Can
per
you
se.
test if someone's had COVID? Like, how far back do these tests go?
Yeah, so I think we still rely on what I call antigen testing,
Which is the PCR, right?
no, antigen testing is
It's the ART.
Yeah,
Oh,
that's
the
correct.
ART,
Yeah.
right,
Yes,
okay.
the antigen rapid test.
Yeah, okay.
So that tells you that you had a recent infection most of the times. And then your PCR test will tell you that you had either a current or a previous infection most of the time within the past 2 to 3 months.
Okay.
It's interesting that you say that because I got COVID. My COVID was when I was on holiday. I was in Australia. And it's very interesting in Australia. There are many doctors in Australia that don't trust the ART. They say because you can take an ART and you'll be negative. But you take a PCR
Yeah, exactly.
and you're still positive.
Yeah, because they go
Yes.
deeper in.
Yeah. So how does that work then?
Yes, I think that's a very good point. So it is recognized that the ART testing is somewhat dependent on how you test it. So, for example, if you really don't go deep enough,
Yeah.
all right, or you don't make too many turns of the the testing kit enough, sometimes you may not be able to pick up. And it's actually we do recognize actually that. Sometimes in the initial phase of the illness, your ART may be negative. So
Right.
sometimes in fact, at one point in time, WHO or CDC came up with recommendations especially when COVID was really on a rampage, we had actually advised patients if the first time you test is negative and you really strongly suspect it's COVID, you repeat the ART test about 48 hours.
Okay, just hold that thought. We're just going to go for a traffic update and then we'll go back on air.
Will do. Thank you.
Kiss 92 traffic.
We've got all the usual delays across the expressways. Look out for the PIE towards Tuas. A vehicle broken down after the KPE exit. Also on the KJE towards the PIE. A vehicle broken down before the PIE Changi exit. Please stay within the speed limit. Have everyone in your car buckled up. Be safe as you drive today.
It is Good Morning, Doctor, with Dr. Adrian Chan, Respiratory Physician and Intensivist at Mount Elizabeth Novena Hospital. And we're talking about whether having had COVID-19 makes one immune to COVID-19. But one word that has been thrown around a lot in the past couple of years is long COVID. Tell us a little bit more about long COVID.
Yes. So I think all of us, a majority of us, will be symptomatic during the acute illness, but I think one of the unique things about COVID is that it tends to create lingering symptoms. I think all of us, mostly majority of us in this studio here, have had COVID before, and we sort of realized that in cases of normal flus, the symptoms would probably last a few days, maybe up to a week. But in COVID, one of the unique things, really, the symptoms do stretch on for quite a while. And arbitrarily, the definition of long COVID is that if you have symptoms for at least 2 to 3 months per se, and the symptoms can be a variety. It can range from respiratory symptoms such as cough, breathless. It can be neurological symptoms such as brain fog or headache, right? It can even be chest symptoms such as palpitations, chest discomfort, drop in effort tolerance or exercise tolerance.
And being lethargic as well, right?
Yes, correct. So it's a variety of symptoms. So all these symptoms have been recognized because there are, and if you look at the various data published, even up to 5 to 20% of patients may suffer from long COVID. So it is important to recognize, and essentially I think we need to have more studies to try and define what exactly is long COVID. Why is it different from other viruses that they can create such long, prolonged symptoms?
Yeah, because
okay.
we're hearing things that long COVID can affect almost every organ in the body.
Well, I think all of us who have experienced COVID or seen enough COVID patients will say that the patients have had a variety of symptoms.
Yeah.
There have been some recent studies, Doctor, that has said that COVID-19 has been associated with insulin resistance. Because I was just talking to a friend of mine yesterday who has diabetes. And what do you have to say about that?
Well, it's theoretically possible because in long COVID, we sort of recognize that it is an inflammatory condition. So the inflammation that's created by the COVID virus tends to linger on. So I do think that it is possible, all right, although not very common, all right, but we still have to keep it at the back of our minds, right? Whether or not it affects the pancreas, right? So this is one of the organs that in the abdomen of the body. We have also seen some. If you ask our fellow gastroenterology colleagues, I think they have also seen some symptoms associated with COVID as well.
Okay, all right. Okay, let's go back on the Big Show TV and talk a little bit more to Dr. Chan about COVID-19 and whether you will be immune to it if you've had it. Right now, coming up, more great music, but the time now is 8:15.
Kiss 92 Time Check brought to you by Putian.
Okay, I have a question.
Yeah. Sure.
Well, actually, not really a question. I guess Aloysius has a question. He says, "Good morning, Dr. Chan. I already took 4 jabs of COVID-19 vaccines. Should I take another? Thank you."
The booster shots.
Yeah, I didn't. After I got COVID, it was after my first. Or you take the 2 jabs and then you have the booster. So I took 1 booster and then I had COVID. And my mom said I wouldn't have to take the booster for another
year.
6 months or a year.
Yeah, I think a year.
Yeah, so it's been almost a year since then. Should I get a booster?
Very good question, and I think again it boils down to the individual. So earlier I mentioned about risk factors. If you have the risk factors that I've mentioned, or perhaps you have discussed with the doctor and the doctor feels that you're going to be more susceptible to COVID infections, then I think it is still recommended that you go for the updated COVID vaccination. And the World Health Organization, the various international bodies, and even fortunately our local government as well and ministry are very in tune with the latest updates from COVID, right? So if they make an announcement, it is, and for individuals who are susceptible, I think it's still reasonable to go for it. We also have to keep an eye out, what's the data from the new subvariant as well, Iris. I think all of us are looking on with interest. How much damage will it cause? How much, sickness we will create in our individuals. So keep a lookout for the updates from our ministry. So I think it really offers good advice, and I hope that, the population will follow the advice accordingly.
Is there, because I'm waiting for it, and I think it's going to happen. I think we're going to have a COVID vaccine that you're going to take every year, just like you take a flu shot. That's what it's going to be. That's what it's going to be. But right now, I've had my shot, I've had my boosters, whatever. But even those don't last forever.
Yeah.
Correct?
Yeah.
So is there a test I can go for? Is there something I can do to find out my level of immunity?
Yes. So
good question.
A very good question. I think this has been asked by many of our patients before. So first up, I think that the key message that we need to take home about vaccines is that while it is effective, it doesn't last forever. Right? So the vaccines, even if it's the standard or the appropriate vaccines, most of the time we tend to find that the acquired immunity from vaccinations lasts for about anywhere between 9 months to a year, sometimes even shorter if you have the risk factors or your immune system just is not able to build up the acquired immunity. So there are tests out there that look for neutralizing antibodies in oneself.
Which is a good thing to have, right?
Yes,
Okay.
it is a good thing. But it is not a direct correlation with your ability to fight COVID-19 infection. It is true, maybe you have a little bit higher immunity, but it doesn't mean that just because your levels are very high means that you will be immune
to a particular disease.
Correct.
Yeah.
Obviously, if it's very low, then we start to get a little bit worried as well. Because remember, as what I alluded earlier, there are many factors as to how you are susceptible to COVID infection at that particular time and place.
I have never had a flu shot in my life.
What?
And I did not get the booster shot.
Okay.
I had my 2 shots.
Okay.
Oh.
Is that okay?
Before you got COVID?
No, I had COVID after my first shot, and then I had COVID after my second shot.
Yeah.
But I didn't get my booster shot.
It was the shots that gave you
exactly,
COVID. That's what
yeah.
it was.
Is that possible? No, all jokes aside,
yeah.
but I mean, I don't intend to get it unless it's absolutely necessary. Is that
Yes.
okay?
Well, I guess two slightly different aspects here. So the flu virus that you mentioned about the flu shot, I think that
The yearly one.
Yes, that one we have very good data because the flu virus has been around for such a long time.
But
So
it evolves. That's
it
why you need the
evolves.
update,
Correct,
right?
yes. And I think we also suspect that COVID is going down
The same way.
route, right? We hope that it will never come up with a variant that's so severe as what we encountered in the earlier phases, right? But it will still cause illness,
Yeah.
right? So I think that as we go along and find out more about the variants about COVID, we will tend to find that, the virus will need updating of our immune system. So it is very likely along the line, okay, as we receive news about the new COVID vaccines, the newer COVID vaccines, then we weigh the pros and cons. And if, let's say, it's going to be a more severe variant, I think it is worthwhile to update our vaccinations.
Okay.
I have a question.
Yes, sir.
I have a heart condition, so I take multiple medications, cholesterol and beta blockers and blah, 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 blah. And many people have different conditions and they're on regular medication.
Yes.
Does that medication affect the longevity of the immunity one gets when one gets vaccinated?
Yep. So very good question. I think it's more the underlying condition, the underlying chronic condition. So it is unfortunate that, yes, COVID heart condition is recognized with a slightly increased risk of getting future COVID infections. So it's good to protect yourself. So you probably may classify yourself as one of the slightly more vulnerable individuals. So it's good to get vaccinated, right? Now, medications really, then depends on what kind of medications. Thankfully, for most of the standard heart medicines, they don't usually increase your risk of getting COVID-19 infections. There are some medicines out there, though, that actually do make your immune system lower. So I give an example of one class of medicines called steroids. Right? Steroids is actually a very common medicines that can be used for a variety of conditions.
Yeah.
For most patients, they take it with some specific conditions. So if there's some immune system conditions, the doctor may prescribe for them, and that's one of the medications that may increase your risk. Right? If you take this medicine long term, it's not saying it's no good. The medicine there is a clinical indication, but it may increase your risk.
Okay. In Malaysia, they're testing, when they do tests at the doctors now, they have this kit that is not just for COVID-19. They've got COVID-19, influenza A, influenza B, RSV, and adeno.
Yes.
Like five in one. It tests for all five.
Whoa.
Is that the future of how tests are going to be? I don't know if we are doing it here where it's all in one, because I haven't been for a test like that at a doctor's recently. But is that how it's going to be? And then Eris will probably be added on, and then in the end you're going to have like 100 little vials that you have to test.
Very good question. So this technology.
Okay, wait. Why don't we go on air and then I'll ask you that again.
Will do.
Yeah. But are we already doing that here? Multiple? Okay.
We are.
Wow.
That's why I love her.
Kiss 92 traffic.
The PIE towards Tuas, an accident after the KPE exit. Look out for that. We also have the KJE towards the PIE, a vehicle broken down before the PIE Changi exit. Look out for those two areas, please. Stay within the speed limit. Have everyone buckled up. Be safe as you drive today.
It's Good Morning Doctor time here on The Big Show, and we have Dr. Adrian Chan from Mount Elizabeth Novena Hospital. So, Dr. Chan, we've been talking about COVID-19, and on The Big Show TV, I was asking you about these test kits. Now, at home, we have test kits that are single trays. But in Malaysia, I know, and I think we have them here as well, the trays have become bigger because now there are multiple trays. It's COVID-19, it's influenza A, influenza B, RSV, adeno. Is that tray going to be so long that it's going to become like 20 tests in one?
Well, it won't be 20. It's not 20 tests at this point in time, but yes, we do have the ability to test for a panel of viruses and certain common bacteria.
From the same sample?
From the
Okay.
same
It's
sample.
a nose swab.
The
Yes,
nose
it's
swab,
what
okay.
we call a nose or nasopharyngeal swab per se. And it's actually a PCR test, which is probably quite accurate.
Okay.
All right. So essentially, we call this a respiratory panel or a respiratory multiplex PCR panel. That's the medical name.
Right,
for
okay.
It. Yeah. It is available. Not common yet because obviously it's a bit more expensive than the standard ART. But
Right.
if the physician or the specialist feels that, this respiratory tract infection is more severe and warrants closer investigation, I think it is an appropriate test to
Okay. Okay.
We need to put this to rest. Every time we deal with COVID
Yeah.
with a doctor, this same question comes up.
Yeah.
And it's from Chris Naraj.
Yeah.
Unpublished clinical studies mention that COVID vaccines alter the DNA.
How true or how untrue is that?
Right. So I think first off, we need to understand what is the COVID vaccine actually.
Yeah.
Right. So essentially, there are various versions of the COVID vaccine. The standard ones are essentially mRNA vaccines. Now, mRNA vaccine is not something that's going to alter the internal DNA. So
Right.
let's put that to rest.
You're not going to
Okay.
become somebody else's
No,
child.
we're
or
not going to
anything.
be a mutant.
So we're not going to turn into the Incredible Hulk.
And grow tails
That's what
and
I was
stuff.
hoping
Okay.
No. Yeah, I think that's what we if we understand the rationale behind mRNA vaccines, essentially it's input into our cells, all right, and then the mRNA helps the immune system to churn out antibodies.
Okay.
That's what it does, but it doesn't imprint into our own DNA. So that's what I can assure the audience per se. Then there are also other vaccines like the Novavax, which is a more standard protein vaccine per se. But overall, no, thankfully they don't alter our DNA.
Okay.
Done. Put
Now,
it to sleep.
I know we're here to talk about COVID-19, but influenza A was going around like a hurricane just recently. Everyone had it.
Yeah.
Has that subsided? And is there anything else for us to look out for besides this Eris?
Yes, I think. I think as part of return to normalcy of life, we have all come out. The safe distancing measures have relaxed. We have resumed our normal lives, and it is inevitable that there will be increased exposure for everyone to all the respiratory viruses. So our old friends are back.
Yeah,
our old
okay.
friends are back.
They've always been around,
They've
basically.
always been around, yeah. So for about 2-3 years, we were dealing mainly with COVID. But in the past, 1 year plus or so, we have seen a resurgence of all the respiratory virus. And it could be influenza. There are other viruses like rhinovirus, respiratory syncytial virus or RSV, or perhaps, adenovirus. These are the fairly common respiratory viruses. They're all back. The key thing is to still take precautions, right? If you are vulnerable, try not to mingle with the crowds, get your updated flu shots. I think these are still important. But yes, we have seen a resurgence. And just like all the flu pandemics and epidemics, it will strike our population. But as long as we try and cope with it, it should wane down until the next wave comes again.
Last question. So some people have taken the mRNA vaccines and have had side effects. So they're worried about taking a booster or anything. So, and they're saying, is there a more traditional vaccine that they can use to help with their immunity against COVID?
Yeah, so I think it's unfortunate while there are a minority of patients who suffer from side effects or perhaps allergic reactions of the vaccine. I think we have to acknowledge that. It's like any vaccines or any medication, there will be a minority that get it. But the overriding, I will emphasize, is the overriding indication or the benefit is still to, to reduce the severity of COVID symptoms or to reduce the risk of getting COVID. So I think that is very clear. Now, as to whether the vaccine are there more traditional vaccines, I think we still have to understand the efficacy of the vaccine. Right now, the efficacy is still better with the mRNA vaccines, and that's why I think the pharmaceutical companies have been relying on what we call the latest round will be the bivalent vaccines, because they are known to be effective. And the traditional vaccines may not be that effective. I think, again, it's a combination of your own immune system being able to build up the immunity from the vaccines.
Okay. Well, doctor, super interesting. We always feel like we need more time with the doctors from Mount Elizabeth Hospital. And so many questions that we have. Thank you so much for being with us, Dr.
Pleasure.
Chan. It's been very, very informative. Remember, if you're just tuning in now, you can always go back to our YouTube and Facebook channels to re-watch this video. It has been Good Morning Doctor.
Thanks for tuning in.